Magandang umaga Pilipinas, lalong-lalo na sa ating mga kababayan dito sa Eastern Visayas. Maupay na aga haaton nga tanan o maayong buntag sa inyong tanan. Welcome po sa third episode ng ating programang Dayon Kitaha DOH. Sa lahat po ng ating mga viewers and listeners this morning, we hope that you are in your healthiest kasi napaka-interesting po ng ating topic this morning. We will be getting to know more ang nag-iisang Apex Hospital dito po sa Region 8, ang Eastern Visayas Medical Center. Kaya tara, Dayon! Ang Eastern Visayas Medical Center ay isa sa mga retained hospitals ng Department of Health dito sa Eastern Visayas. Ito ang end referral at nag-iisang Apex Hospital dito sa Region 8. Ang isang Apex Hospital ay tumutukoy sa isang end referral hospital na nag-o-offer o nag-aalok ng mga specialized services alinsunod sa batas at kinukontrata bilang isang standalone facility ng PhilHealth. Ang mga Apex Hospitals ay inaasahan na makapagbibigay ng mga serbisyong pangkalusugan o health services sa lahat ng uri ng illnesses, diseases, deformities at injuries. Dapat itong magkaroon ng mga sertipikado o eligible na mga medical specialists upang makapag-facilitate ng timely, efficient, abot-kaya at accessible na mga diagnosis at treatment for clinical and basic emergency care services. Nakasaad sa Section 18 ng Universal Healthcare Act o Republic Act 11223 ang pagkakaroon ng mga healthcare provider networks that would ensure integration at effective and efficient delivery of both population and individual-based health services. Dahil dito, mahalaga ang ginagampanan ng mga Apex Hospital. In our case, ang Eastern Visayas Medical Center sa ating mga healthcare provider network upang masiguro na tuloy-tuloy ang provision po ng ating quality and comprehensive healthcare mula sa primary level hanggang sa tertiary level. Kaya inaanyayahan ko po kayong lahat na tumutok sa ating episode ngayong umaga, Dayon Kitaha DOH.
A few hundred meters from the famous San Juanico Bridge is the new home of Eastern Visayas Medical Center. But our story does not start here. 105 years ago in the center of Tacloban City, we started as 14-bed Leyte Provincial Hospital that evolved to become EVRMC in 2009 with 500-bed capacity. On November 8, 2013, Super Typhoon Yolanda devastated EVRMC. However, we stood our ground and continuously served Eastern Visayas. In 2018, EVRMC transferred to its current location, upgrading its operations to fulfill its mission. This was made possible by attaining ISO 9001:2015 certification in July 2019. EVRMC took a step further in its transformational journey through the Performance Governance System in November 2019, getting a Silver Trailblazer Award during the initiation. With PGS, EVRMC positioned by 2022 as a Level 3 1,000 authorized bed capacity medical center with end referral centers for neonatal care, cardiac care, rehabilitation medicine, and geriatric medicine, laying the building blocks to become bigger by 2028. In March 2020, COVID-19 pandemic struck. To ensure continuity of care, EVRMC formulated the COVID response framework with the conversion of the old EVRMC campus with COVID laboratory as COVID facility and an extension facility operated as holding area, increasing COVID dedicated beds from 30 to 286. The new EVRMC campus exclusively utilized for non-COVID patients. We strengthened the IPCC, activated the hospital command system, conducted teleconsult, and provided support for our employees. Despite the pandemic, EVRMC remained focused on its strategic direction. Through PGS, Eastern Visayas Medical Center ensures that the people of Region 8 have equitable access to quality healthcare services. These manifest that EVMC truly cares.
Ngayong umaga, ikinalulugod nating makasama ang ating espesyal na panauhin para sa episode natin ngayon. Ang ating panauhin ay may mahigit ng 30 years na experience sa public health. Nagsimula siya bilang Medical Officer 3 mula 1994 hanggang 1997 sa Oras District Hospital at nagsilbing Municipal Health Officer mula 1997 hanggang 2004 sa Rural Health Unit ng Oras Eastern Samar. Mula dito, siya ay nagsilbing Chief of Hospital ng Eastern Samar Provincial Hospital mula 2004 hanggang 2017. Bahagya naman siyang nagsilbing Medical Center Chief 1 ng Eastern Samar Provincial Hospital mula 2017 hanggang 2018. Dulot ng kanyang magandang track record at walang humpay na paglilingkod para sa publiko, siya ay naiangat bilang Medical Center Chief 2 ng Eastern Visayas Medical Center mula 2018 hanggang sa kasalukuyan. Bukod sa kanyang napakalawak na karanasan sa public service sa ngalan ng kalusugan, marami ding natanggap na awards and recognitions ang ating Medical Center Chief. Ilan dito ay yung pagiging certified member of the Philippine College of Hospital Administrators, ang kanyang pagkahalal din bilang President of the Association of Municipal Health Officers of the Philippines, Eastern Samar Chapter mula 1997 hanggang 2001. Siya din ay naging President of the Eastern Samar Medical Society mula 2004 hanggang 2005. Naging Vice President din ng Philippine Hospital Association, Eastern Visayas Chapter from 2005 hanggang 2007. Ang ating Medical Center Chief din ay naging presidente ng Philippine Hospital Association Eastern Samar Chapter from 2007 to 2010. At ang kanyang pagiging recipient ng Philippine Hospital Association Presidential Achievement Award for 3 consecutive years from 2005 to 2007. Siya din ay naging recipient ng Silver Trailblazer Award for Performance Governance System Initiation Revalida. Naging recipient din siya ng Gold Trailblazer Award for Performance Governance System Compliance Revalida at Golden Globe Annual Awards for Outstanding Filipino Achievers. So everyone, kilalanin natin ang ating guest for today, ang Medical Center Chief ng nag-iisang Apex Hospital ng Region 8. Walang iba kundi si Dr. Salvador B. Evardon. Hi Doc! Good morning, Doc!
Yes, good morning ma'am. Magandang umaga. At sa lahat ng nanonood at nakikinig sa ating programang Dayon kita sa DOH. Kinagagalak kong maging panauhin sa araw na ito.
Alright, so how are you today, Doc?
So far, I feel excited na nabigyan tayo ng opportunity para may pahayag at mas makilala pa sa publiko ang Eastern Visayas Medical Center.
Siyempre naman, Doc, kasi you are one of our DOH retained hospitals. Alright, so Doc, ready na po ba tayo?
Yes po.
Alright, sige po. So, unahin na po natin, Doc, ano po ba talaga ang EVMC?
So far, ang Eastern Visayas Medical Center ay ngayon I have 106 years in service, considering that nag-umpisa ang Eastern Visayas Medical Center noong 1916. So as a Leyte Provincial Hospital. So nagsimula po ito as a 14-bed capacity as the Leyte Provincial Hospital that was established in 2016. At saka ito lumaki. Ngayon binigyan tayo ng Republic Act 11567 last June 2021 na nag-increase tayo from 500 to 1,500 bed capacity. And also, binago pa rin, dahil doon sa batas na yon, binago ang Eastern Visayas Regional Medical Center to Eastern Visayas Medical Center para at least makita natin na we are upgrading our services dito at saka mabigyan natin na wala ng border. Lahat ng mga tao o lahat ng mga karatig rehiyon natin, pwede na sila maka-avail ng services dito. And also, that's why for now, dito na tayo sa new location site dahil we have transferred in 2018 here dahil may marching order ang DOH to transfer immediately, considering that the old campus is it is built near the sea at saka prone tayo sa mga disaster.
You considered siya, Doc, as danger zone. Included siya sa danger
so
zone.
actually, it is considered as danger zone. So after the Super Typhoon Yolanda, so the government itself decided to transfer the services to the campus to Bagakay, Barangay 93, Tacloban City, na at least 1 kilometer from the famous San Juanico Bridge. And ngayon, dinesignate ito na through the Universal Healthcare na as an apex hospital and referral, because we are only the DOH level 2 hospital is in Eastern Visayas, and also providing some 16 specialty centers. At saka ngayon, aside from these services that being given in this campus, meron pa tayong mini-maintain na mga facility. Yung old campus natin that is situated at Magsaysay, Tacloban, at least nandun pa ang psychiatry natin, ang water testing lab, ang COVID laboratory natin, at saka yung drug testing laboratory. But for this, we have also an extension facility sa Bilyaba Polyclinic. The Bilyaba Polyclinic, which is situated at the 4th District of Leyte.
Wow! Marami na talaga, Doc, ang mga developments and progress of Eastern Visayas Medical Center.
Yes, because we are expanding it due to universal healthcare, that we can provide the services, the population-based services as well as the individual-based services.
Doc, I have, meron pa akong may nakakatch po na words na sinabi niyo po kanina. You are not limiting yung services niyo within the region lang. Parang hindi lang yung exclusive ang EVMC for Region 8. So we are open to provide services din from other clients from other regions?
Yes, because may mga areas na, like for example, the Caraga region, may malapit silang mga municipality na malapit sa atin, at saka may services sila na wala din sa kanila. So at least they are open to cater the services here. And also we have a neighboring provinces of Bicol, the region itself, Masbate. So more or less, sila nagpupunta rin dito para at least mag-avail ng mga services, considering that we should have a borderless healthcare facility.
Wow, nakaka-proud naman, Doc. I'm pretty sure yung ating health workforce ng Eastern Visayas are so proud being part of this facility or of this institution.
Yes, I hope so, considering that due to the support of the government, it seems that we are given, binigyan tayo ng mga opportunity to expand and the support that is necessary for a medical center.
That is right. So, Doc, ano-ano naman po ang mga basic services or ano-ano po ba yung mga serbisyong binibigay ninyo sa publiko?
So, as a general hospital, we're talking now of the basic services as internal medicine, surgery, OB-GYN, at saka pediatrics. So, these are the basic common services and the OPD. But as a medical center, we have expanded our services to make it a specialty services, considering that as an apex, we are to provide the multi-specialty services that are not found dito sa baba, dito sa mga provincial hospital. Like for example, in the OPD, ngayon may bago tayong advanced technology here. Mayroon tayong bone densitometry para makita sa mga matatanda in terms of the integrity ng mga bone nila, para to prevent at least meron tayong preventions with regards to bone loss. And also we have the cardiac care services, such as vascular Doppler scan, to the echo, critical congenital screening for heart diseases. Meron din tayong mga advanced rehabilitation medicine services. Like for example, ito musculoskeletal ultrasound, cryotherapy, electromyography, and shockwave machine. So para din sa mga OFW clinic, may OFW clinic din tayo na at least yung mga seafarers o kaya mga overseas workers hindi na pumunta ng Maynila para mag-conduct ng medical examination. Meron na po tayo. And as well, kahit sa Caraga, walang OFW clinic. So, we are open na bigyan sila ng serbisyo para at least we bring the services closer to the people. At least meron tayong mga alternative medicine. This is mandated also by law. So, increase ang mga cancer patients na nadadiagnose sa Manila. So, during dito, at least ang mga dadayo ko sa Manila, nagko-continue ng chemotherapy dito na wala noon. So ngayon, at least may mga services na tayo ng chemotherapy. So the family planning services. So mga advanced na mga procedure in terms of endoscopy, bronchoscopy, and colonoscopy. And more or less meron tayo din mga services sa dermatology, so mga skin diseases. Meron tayo sa mga HAC at saka HIV clinic kasi alam naman natin na Region 8 is more or less increasing number, and I think we are the highest incidence of HIV. And meron din tayong mga Women and Child Protection Unit, the neuropsychological services, supportive hospice and palliative medicine. So more or less, meron tayong general services at saka may specialty service. So siguro kung i-isa-isa natin, aabot tayo ng isang linggo to identify the services that we have. But overall, siguro kailangan na lang natin ipalam sa kanila na there are general services na makikita natin doon sa healthcare provider network sa baba, at saka meron din tayong mga specialty services na kailangan natin dito, like for example sa neonatal ICU. Yun ang mga ano natin na more or less human milk bank, at saka for like for example the low vision, meron na rin tayo to prevent some of these eye diseases, at saka meron tayong mga children with disability hub. And also with regards to the benefit package, meron na tayong 6 kasi this is part of our financial management, that we can increase the services through improving our finances through PhilHealth. So ito naman po ay walang bayad. Like for example, the children with developmental disability, children with mobility impairment, CMOR and expanded CMOR, premature and small newborns, diagnosis of rheumatic heart disease for the children. So ito ay walang bayad, pero kami ang binabayaran dito ng PhilHealth. Kasi as part ng universal healthcare, more or less all should avail of the services with free. So this is part of mandate that we have to increase the financial protection among our constituents.
Magandang balita yun lahat, Doc, no? Kasi malaking tulong yun sa ating mga publiko, especially yung mga taga-Eastern Visayas, kasi hindi na sila kailangang pumunta sa ibang rehiyon, pumunta sa Manila just to avail with the services na kaya na pala ng Eastern Visayas Medical Center.
Kasi,
so malaki talagang tulong.
Like for example, one of our advanced services here, ang angiogram natin. So kung may mga butas yung mga heart natin, pwede na natin operahan dito. Pwede na tayo maglagay ng mga stent, magpa-angiogram. So mayroong cardiac laboratory tayo na functional so far. So more or less yun ang mga advanced na mga services natin na at least hindi na sila pupunta ng Cebu o Manila para dun sa for emergency needs. Kasi yung iba natin dito, yung mayayaman na ita-transport dan using the air ambulance na it costs 600,000 ang transfer pa lang papunta sa Manila. So right now in such an emergency cases pwede na sa atin.
Pwede na sa FENC, yes. So by the way, Doc, maraming nagtatanong, may semi-private or private rooms ba or ward or what do you call this sa ating facility sa EVNC?
So far ngayon ang may semi-private tayo at saka private muna na services sa panganganak sa OB-GYN sa RHNC. So but we are planning to open our semi-private our private rooms this coming April 1. So at least we have to open 67 beds to include na sa RHNC, considering that our mandate that at least 10% of our bed capacity will be dedicated para sa private, but 90% would be for basic ward accommodation.
So, with all the services po na na-mention niyo po kanina, kumusta naman po ang resources ng ating facility, ng Eastern Visayas Medical Center? Mayroon po ba tayong mga challenges ukol dito?
So far, lahat naman na tayo may mga challenges in terms of operation, kasi due to complexity ng mga services. So more or less, meron din tayong mga loopholes medyo. But right now, it seems that we are being provided by the government, especially our personal services, our MOE, and capital outlay. So right now, this year, we're given budget alone for the equipment and infrastructure. We're given 448 million, and for our personal services, more or less 1.2 billion. And our MOE is 448 million. So ito ay for the overall operation ng hospital natin. But some of our, and also given also the support from the Office of the President through the Social Fund, Office of the Vice President, they are given 7.5 million, 15 million from the Office of the President. We are given MAIP. Last year, our MAIP, more or less 300 million that was given to us. That's why ngayon, may bago tayong programa dito na at least lahat ng lalabas na pasyente makakabil ng mga take-home medication nila. This is one of a kind because sa tulong din ng Tingog Party List na they provided us 100 million for this program.
Wow, that's good news din po sa ating mga nakikinig at mga viewers, no? Makaka-avail sila ng ganitong mga serbisyo at insured at assured sila na maganda yung services kasi mayroon pong resources ang ating facility. Alright, so meron po ba tayong mechanism ang Eastern Visayas Medical Center na masiguro na at par po yung ating mga serbisyo na maintain po yung standards, yung quality based sa ating DOH standards
yes,
po?
Yes, considering that our aim is to become globally recognized Center of Excellence in Health. So one of our parameters to become a globally globally recognized excellence in health is through the certification, ISO certification, and also the proper governance systems, and also for patient safety. All of these have the evaluation tool that is equated towards sa Asian integration by 2025. So all of these are being provided as a benchmark or a part of the measurement or a feedback mechanism so that we can provide the services that is more or less competitive with the other ASEAN country or the Southeast Asia. yes, it is good that we have this competition in terms of best practices, and also we can also come up at least those best practices pwede rin nating ma-adapt sa kanila papunta sa atin, but more or less we are being measured the quality of services, the performance of this institution to the ISO. Because ISO more or less it standardized the processes and harmonize all those things so that at least there should be an efficient and effective delivery of quality service.
Yan. So, again, magandang balita po sa ating publiko knowing that our facility ay may sinusunod po na talagang mga standards in providing or in delivering their healthcare services. And
also, for our human resource management, so we are a level 2 Prime HRM now.
Wow.
It is based on the accreditation. This is the Prime HRM actually is taken from the Australian, that is adapted from the Australian government, that we should measure the competence, the processes and best practices of the human resource management in terms of the recruitment, selection, and placement para at least mapapabilis natin ang selection process natin, then at least to provide training and development para mabigyan natin ng learning development ang mga empleyado natin, then to provide also recognition in terms of appraisal of their performance, and that is attached with recognition and awards.
So, magandang balita din po magandang balita din sa ating mga health workforce ng Eastern Visayas Medical Center. Alright, so before tayo mag-break, Doc Ivardone, last question natin, may feedback mechanism po ba ang Eastern Visayas Medical Center ukol sa mga serbisyong hinahatid sa ating mga kliyente?
Yes, kasi kailangan natin ang feedback mechanism for us to know paano pa namin mapapa-improve yung mga services natin. So, at least every 3 months we have collected and consolidated lahat ng mga client satisfaction survey natin para at least kung may mga constructive criticism then doon na makikita natin, at least makorek natin kasi this is a part of the process. That's why kaya nga tayo may ISO para we should have to at least comply with the standard. So, and also we have also from our ends, so we are measuring the feedback from the external clients and also from the internal itself. But also we are also having our external providers client satisfaction to measure also the services being rendered by our suppliers, so that at least for the next transaction, at least we will be able to say that they can deliver on time. Kasi kailangan natin palagi dito ang mga supplies, especially these drugs and medicine and medical supplies.
Alright, so yun, napakaganda ng mga discussion natin with Doc Ivardone. So more or less, meron na po tayong idea or better picture of what Eastern Visayas Medical Center is and how it operates. So now, we will take a break at sa pagbabalik po natin, we will discuss naman kung ano yung universal healthcare in the context po ng Eastern Visayas Medical Center.
Minsan, nagutom si Scott. Junk food o pinggang Pinoy? Pinggang Pinoy! Minsan si Scott, after work, inaya ng barkada. Party o exercise? Exercise! Minsan, yung pamangkin ni Scott, papabayaan walang bakuna o pababakunahan? Pababakunahan! Para katawan ay laging win, healthy habits ang sundin.
Ano Ano nga ba ang antibiotics? Ito'y mga gamot laban sa mga sakit mula sa impeksyon ng bakterya. Ano naman ang antimicrobial resistance? Ito'y ang kakayahan ng mikrobyo na labanan ng mga antimicrobial o tinatawag din na AMR. Ito'y delikado sa kalusugan dahil nagiging di epektibo ang gamot. Paano ba nangyayari ang AMR? Una, impeksyon. Ikalawa, pagdami ng mikrobyo. Ikatlo, sakit. At hindi tamang paggamot. Huwag maging biktima ng AMR. Gamitin ng tama ang antibiotics para maiwasan ang resistensya.
Mahalagang paalala sa Department of Health.
Ang Pilipinas ay may ada nagiging taas nga kaso han may depresyon. Ang kadamaan han mga naguna-una pagpakamatay ay may ada hini. Ang mga sintomas hini indanay diri nakikitaan pero ang kondisyon hini nga sakit na una apektado ang abilidad han pagkios ng tao nagdamo ang dili maaram hini. Kung ikaw may kilala ka nga nag-aantos nga nakaka-eksperyensya ng depresyon nga sakit na paguna-una, tawagi ini nga mga numero 0947-423-8423 or 0966-531-6464. Iniimbay magno ng Department of Health.
Tagulan na naman, iwasan nating magkaroon ng diarrhea, cholera at iba pang mga food and waterborne diseases. Ugaliing maghugas ng kamay at panatiliing malinis ang paligid. Pag-iwalayin ng mga karne at gulay o ilagay ang pagkain sa ref o sa wastong lagayan nito. Siguraduhin ligtas ang ginagamit na tubig at ang mga kasangkapang gagamitin sa pagluluto. Ligtas sa tubig at pagkain, siguraduhin para sa isang healthy Pilipinas. Mahalagang paalala mula sa Department of Health.
Alam mo ba na patuloy na tumataas ang kaso ng HIV sa buong bansa? Ang HIV ay isang uri ng mikrobyo na inaatake o pinapahina ang immune system at ito ay kumakalat sa dugo. Mayroong tatlong pamamaraan ng pagkahawa ng HIV: pagkipagtalik ng walang proteksyon, pagtanggap ng kontaminadong lugo, at mula sa inang positibo ng HIV patungo sa kanyang anak. Sa simpleng blood test, malaki ang pagbabago. Huwag matakot magpakonsulta. Magpa-test na.
Mahalagang paalala mula sa Department of Health.
Ang ganda-ganda ko talaga!
Maganda sana, pero ano yan?
Ang lang yan?
Maputla? May nararamdaman ka ba?
Wala.
Baka yan ay sakit na dulot ng isang bakterya. Mas kilala sa tawag na leprosy.
Leprosy? Tatapan ko na lang.
Alam mo ba na pwede yang mauwi sa...
Oh no!
Relax lang! Nagagamot ang leprosy. Kaya kumonsulta ka agad sa health center para masimulan ang gamutan. Palakasin ang resistensya at tuloy-tuloy na gamutan ang kailangan. Mga may leprosy, di dapat pandirihan. Isang mensahe mula sa Department of Health.
Bawat oras, maraming mga buntis, mga may leukemia, mga taong may sakit sa dugo, mga pasyenteng kailangang maoperahan at mga naaksidente ang nangangailangan ng dugo. Kung ikaw ay 16 to 65 years old, malusog, at may timbang na hindi bababa sa 50 kilograms, be a volunteer blood donor. Bawat isang bag ng dugo mo ay maaaring makasagip at makagdugtong ng 3 hanggang 4 na buhay. Help save lives. Donate blood.
Mahalagang paalala mula sa Department of Health.
Sa pagsasabatas ng RA 11223 or ang Universal Healthcare Act, malaki ang kontribusyon ng ating mga apex hospital sa pagpapatupad nito. So, speaking of EVMC, Doc, ano ba ang tungkulin nito sa pagpapatupad ng UHC sa Region 8?
Tama po yan, Ma'am Jillian. Actually, ang Eastern Visayas Medical Center as an apex hospital, malaki ang ginagampanan tungkulin through the universal healthcare. So as through this, we are considered as an referral hospital, and also we are considered as an apex hospital, meaning that at the regional level, kami ang last na referral system from the primary healthcare provider networks down to healthcare provider network, and also going up to this institution. So as in line with the universal healthcare, ang hospital natin ay we are providing specialized services na to facilitate na mabigyan natin ng timely and efficient and effective quality service to our people through diagnosis and treatment for clinical services and basic emergency care services. So if we have to sum up, actually, malaki ang ginagampanan natin na tungkulin through the universal healthcare because we are mandated to provide the tertiary cases. We have to cater all the tertiary cases para at least naman para ma-decongest tayo. That's why ang focus ngayon is to improve and capacitate the services down at the healthcare provider networks, and also to delineate as an apex hospital ang EVMC, sana na at least makapag-provide kami ng multi-specialty services na hindi nakikita doon sa baba.
That is right. So, kanina Doc, na-mention niyo po na marami kayong mga specialty centers, and as mandated by the law, yung mga apex hospital or yung mga regional hospitals are required to establish certain specialty centers. Am I right, Doc?
Yes.
Opo. So, sa EVMC, ano-ano na po ba yung ating mga specialty centers?
Since we are mandated by law to provide the specialty services, so more or less ang designation namin, we are given 15 designated specialty center. Overall, kung titingnan natin, 16 lahat yon. So ang EVRMC based doon sa law, binigyan tayo ng 15 specialty center to comply with. Pero part of our initiative, dinagdagan namin ng dermatology as hospital-initiated specialty services. Kasi bago pa itong law, more or less na-establish natin ito, fully equipped na tayo, at saka may mga consultant na tayo dito. So ngayon, ang ano natin, based doon sa roadmap ng DOH para sa atin na at least ma-meet natin ang 80% functionality of this special services. At least ang part of those is cardiovascular care, renal care and transplant center, lung care, brain and spine, orthopedic center, physical rehabilitation medicine, mental health. Yun ang we're considered as advanced comprehensive care, neonatal care, born care, trauma, toxicology, cancer, infectious disease and tropical medicine, geriatric care, and eye care. And to sum it all, we have 15 designated and one hospital-initiated specialty center, that is the dermatology.
So, in terms of the UHC, bilang apex hospital ang ng Eastern Visayas, ano naman po ang aasahan ng publiko na maibibigay ng EVMC?
So, as an apex hospital, actually, we have four basic and integrated services that we can provide. Una is to provide multi-specialty services. Yun ang sinasabi natin na these services that are more or less catered by subspecialized physicians and other services, so that we can provide quality, efficient, and patient-centered clinical services. At saka, second is we should have to capacitate dito sa baba with regards providing teaching and training the services para at least ma-decongest tayo. That's why we are accepting residency training program para after and lateral entry, para at least after ng graduation nila, they can go back to the periphery to provide the services. So para ma-improve nila ang capability nila, to increase from level 1 to level 2. So more or less we provide trainings for the laboratory para kasi ang level 2 hospital, they should be at least have license to operate na level 3, na at least makikita mo lang dito sa amin na mga bacteriology, micro, yung mga hindi makikita sa secondary or level 2 na mga laboratory facility. So ang other than that is yung mga training actually ng mga physical therapy, yung mga training ng mga nurses, especially sa operating room. So all of them will be provided by an institution as part of being an apex hospital. And also the functionality of referral system. Kasi more or less, meron tayong one hospital command system that is being manned sa regional office, but as part of our support system, at least kami ang last recourse na i-refer ang pasyente because we are the apex and in referral, so more or less we have to accept all the referral, especially these tertiary cases. And also as a part of fourth function of being the apex hospital is to provide clinical public health and operations research para at least makita natin kung ano ang mga pwede pa nating ma-improve na pwedeng magamit sa lahat na maging applicable, maging policy na para at least kung ito'y maging policy na ma-improve natin ang mga services. Right now, we're given support from DOST in terms of training. So, merong training that would cost 1,800,000, and also we also extending researches down to the periphery para at least sila mismo makagawa ng mga process improvement studies para mapakita at least ma-improve na nila ang processes through their own.
Okay, Doc. So, as we are gearing towards the full implementation talaga ng DOH, considering po na working pa lang, even sa sinasabi nyo nga sa periphery, working pa ang ating mga LGUs to form financial and technical integration. So, pero sa EVMC po, ano po yung ating aasahang magiging mga pagbabago sa inyong facility for the implementation po ng UHC?
Kung susundin natin ang implementing guidelines, definitely we are providing multi-specialty services, especially these tertiary cases. And also, we can provide effective patients navigation through the public health unit. So at least there should be a collaboration from the different public health unit down the line para at least ma-improve natin ang referral, either it is emergency or non-emergency, and also within the hospital also, public health unit should provide the services through patients navigation, kung saan sila papupunta, kung para ba sila sa Katla, papunta ba sila sa radiologic, papunta sila sa laboratory, or papunta din sila sa malasakit. So that's part of the patient's navigation within the hospital, and also patient's navigation from internal to outside. So ang window ng hospital is the public health unit that at least they can navigate, they can collaborate and towards cooperation. That's why ang public health unit more or less sila ngayon ang nag-implement ng population-based. The public health program, this population-based program, silang in charge to implement this program, especially the surveillance. Kasi kailangan tayo may reporting system every Monday, the notifiable diseases, and also more or less ang pagbabago lang ng public health unit in light of the universal healthcare is through patient's navigation.
So parang mas na-strengthen and mas na-improve po yung ating coordination
Yes,
within and outside of the facility.
Yeah, kasi ang public health unit is kailangan talaga maging functional. Kasi based on the sa computation lang natin ng imuuwi namin yung operational cost, one of the factor is that being considered is the functionality of the public health unit. So 15% of our imuuwi, our operational costs for 2024 are taken from the rating of the public health unit system.
All right, so Doc, as we end this program, bilang namumuno po ng nag-iisang Apex Hospital dito sa Region 8, ano po yung ating mensahe sa ating mga kliyente, sa publiko po, sa people of Eastern Visayas, or ano din po yung ating mga mensahe sa ating mga health workers sa baba?
Okay. So we should provide commitment through the universal health care. As we are guided from that we should have to provide the quality service, considering that our goal is for a better health outcome, to improve the responsiveness and accessibility of our services to the common tao, and also to increase financial protection for this purpose. And also, being the Apex Hospital, we are the end referral. So more or less, we need to advance. We need to sustain the operation and provide more advanced services so that para ma-realize natin ang universal healthcare. So right now, our plans towards attaining the goal of universal healthcare is to increase our residency training program. Right now, we have only 15 accredited training program, but we have to increase it to, although we have 15 residency training program, we have only 12 accredited and 3 non-accredited. So, for this 3, in 2 years' time, we need to be accredited so that we should become competitive with the other regions in terms of the services that being provided. And also, right now we have two fellowship training program, the hospice and palliative care and geriatric medicine. But our plans is to increase this in the pipeline is the fellowship for cardiology, fellowship for nephrology, fellowship for OB ultrasound, and also to complete the infrastructure, the equipment that is based on the stratified framework for the functionality of the specialty centers. So at least you have 80% functionality. More or less, among the 16 specialty center, we attain only 9. So more or less, we lack about 7. So hoping that in the end, we should achieve the goal that is being promised and provided by the universal healthcare.
Well said, Doc. So, alright, sana ay mas nakilala pa natin ang Eastern Visayas Medical Center at nagkaroon tayo ng mas malalim na understanding sa kung ano yung role na ginagampanan ng ating Apex Hospital sa pagpapatupad ng universal healthcare sa ating rehiyon na patuloy nating isinusulong. So, kasama na rin yung mga specialty centers nila. I hope na tandaan natin yun lahat. Alright, so bago po tayo magpaalam, we would like to thank our guest, Dr. Ivardone, for gracing our show. Maraming salamat po. Kayo po yung unang hospital po na nag-accept sa amin. We will be having our next episodes with the other DOH retained hospital and our treatment rehabilitation center. So maraming salamat po, Doc.
Thank you for having me, and Dayon kamuha, EVMC.
Yan! Alright. So, thank you po again sa lahat po ng mga nanunood at sumusubaybay sa ating programa ngayong umaga. Alam ko, kulang po yung oras. Marami yung dapat nating pag-usapan about Eastern Visayas Medical Center. Ngunit, we would like to give this good news to everyone. Mayroon po tayong susunod pang mga episodes with Eastern Visayas Medical Center focusing on the different specialty centers for the information po ng publiko. So yan, so tutukan nyo po kami every Thursdays at 9 to 10 a.m. dito po sa PRTV 12. Subaybayan niyo rin po ang aming programang Ansumatan DOH. Live po yan every Tuesdays 9 to 10 a.m. Again, maraming salamat po. Ito po si Jeline Lopez Malibago, ang Information Officer ng Department of Health, Eastern Visayas Center for Health Development. Samahan niyo po ulit ako next week sa parehong oras para sa panibagong episode. Kita-kits po tayo. Dayon kita, DOH.